Well, it's not often anyone will sit down to have an in-depth discussion about your colon, but that's what we're doing here on Morning North this morning. That's because March is Colon Cancer Awareness Month. Colon cancer is extremely treatable when caught early, but it's the second most deadly cancer in Canada. People are shy to talk about it or get tested for it. The tests and treatments for colon cancer are pretty invasive, but a new surgery is now available for patients that is not as invasive. And Sudbury has one of the only doctors in the country that can perform this procedure. Dr. Antonio Caycedo is a doctor at Health Sciences North, and he is with me in studio this morning to talk a bit about colon cancer and colon cancer awareness. Good morning. Thanks for coming in.
Morning. Thank you for having me.
So, as I mentioned, we know that colon cancer is extremely treatable. 9 times out of 10, it can be treated and people can be cured. So, why is it that colon cancer is still such a difficult topic for people to handle?
It's true. It's a difficult topic for people to handle because it's a very private theme. Like people just don't want to be invaded. People don't want to have their bodies invaded, even though if it is for investigations. And people usually think they're not going to get it. Mm-hmm. What is true is people get it. It's very common, and younger people are now being diagnosed with colon cancer.
How young?
Yeah, like a recent study just published that 1 out of 7 patients are going to be diagnosed with colon cancer younger than age 50.
Wow.
And we've seen that trend. I've seen it. People in their 40s. I think the youngest person I've seen here is 27 years old with colon cancer. Usually, historically, we think of colon cancer as a disease of the elderly, and it's not the case.
Why is it that people seem to be getting it younger and younger?
There's got to be something, I don't think anybody at this point is able to say specifically why, but the evidence suggests that younger and younger people are getting the disease, and potentially those people get better results. The reason is we're probably more aggressive in the treatment for those individuals when they're younger and younger. We're willing to go to the end, which is also the case for other patients, but when you're treating elderly patients, sometimes you got to stop and think, what is the value of doing this for that person to put it through such a problem to get what?
How do you think we should try and get people to be more interested, I guess, in getting tested and in talking about this?
Well, I think ideally people should just, overcome the shame and the fear of being tested for colon cancer. There are different tests, and nowadays there is a big campaign promoting the smear test that people should go and be tested. That is a good way to be tested. However, it's not the perfect way. The most accurate way to actually be tested is by having a colonoscopy. And the guidelines suggest that people at age 50 should have a baseline colonoscopy. And there are different factors that are going to affect that. For instance, your family history. You're more likely to develop a lesion if you have a family member who is a first-degree relative of you that has been diagnosed with colon cancer, or if you had colon cancer in the past. There are some other malignancies that are unrelated, like malignancies in the gastrointestinal system, that also put you at a high risk of developing colon cancer. The lifetime risk of developing colon cancer is about 6%. That is the lifetime risk for everybody on average.
When you do hear of people getting it younger and younger, though, should 50 be the age where you start thinking about going for a colonoscopy? Should it be lower?
Well, that is what the guidelines and the evidence suggests right now. Like even with that study that I was mentioning before, people getting in younger and younger, I don't think they have any evidence at this point to suggest that people should get it younger and younger. Maybe that will come. Eventually, that could be a change that could be implemented. There is not enough resources and enough manpower to get everybody through a colonoscopy. That's why initiatives such as the smear test, the FOBT, fecal occult blood test, are good because they're cost effective. You can have a massive population and test it that way. With that being said, the best and most accurate test is always going to be a colonoscopy.
All right. So you are one of a handful of surgeons in Canada that is doing this new laparoscopic surgery. Can you tell me a bit about that?
Yeah, well, no, I'm not one of the few doing laparoscopic surgery. Okay, laparoscopic surgery is a well-known technique. It's been used for many, many years. There is a lot of people here in Sudbury, well, not a lot, but the group of surgeons in Sudbury, many of them all well-versed in doing laparoscopic surgery. The one new technique that I'm doing, and very few people are doing, is using the same technology, but to treat rectal cancer. So is a combination of laparoscopic surgery through the abdomen and a combination of laparoscopic surgery through the rectum, through the bottom end. So the final outcome is we're going to have a specimen, which is what we resect, that is going to be more precise and is going to be significantly less invasion to the body. This technique is extremely challenging from the technical standpoint, to the point that very few centers in Canada are doing this, and we are one of those few, but it's specifically for rectal cancer.
Right.
I don't want to lift the idea that I'm the only one doing laparoscopic surgery, because it's not true.
All right, but this type of surgery that you are doing, I understand it's not as invasive because you kind of make through 3 little holes in the stomach or a couple little holes in the stomach and then do it. That
is correct, and we use a combination of a natural orifice, which is the anus. We do the operation when the patient is asleep. We go through those little incisions in the abdomen, then we use the anus to do more laparoscopic surgery, and then we remove that specimen, we remove that organ intact through the anus itself. So we use a natural orifice, and you see at the end the outcome is the person is not going to have really any big incisions. That's big because pain is going to be minimal, invasion to the body is going to be minimal, recovery is going to be a lot faster, and the amount of time the patient is going to be in hospital is minimized. Like recently we've seen people that stay in hospital 2 days. That's like absolutely crazy if you go and look at what was the historical for patients going for these type of operations in an open fashion before. 2 days in hospital, which means you're going to be back to your normal life way sooner. You're going to be a productive member of the society way sooner, and the rate of complications, provided everything goes well, is significantly less.
All right. Appreciate you coming in this morning. Thanks very much.
Absolutely.
There you go. That is Dr. Antonio Caycedo, and he is a doctor at Health Sciences North here in Sudbury. March is Colon Cancer Awareness Month, and it's suggested that you do get tested if you are above the age of 50.